Hello medics and welcome to my YouTube video. Today I'm going to be discussing practical procedures. This is a very commonly assessed station in the OSCE. It gives you a chance to practice all those skills that you've been doing and that you've been reading about. Practical procedures may involve doing venipuncture, blood culture, catheterization, and it's worth becoming familiar with the practical procedures that may be assessed in the OSCE. So without further ado, let's get started. Number one, make sure to wash your hands. So it's extremely important, especially in the middle of a global pandemic, to either vocalise and say that you're going to wash your hands or even physically wash your hands. Now this particular OSCE examination is going to be done remotely, so it might be a good idea to actually have an alcohol gel tub there for you, so that when you're in the middle of the OSCE you can say, I'm now putting alcohol gel on my hand, and it'll be a really good prompt to make sure that you remember this. There's no excuse not to wash your hands, especially in a practical procedure. Number two, introduce yourself. So it's extremely important before you do any practical procedure that you explain who you are. So this might involve, I'm John Smith, I'm a third year medical student, or I'm Dr. Smith, I am an FY1. Whatever your position, you have to make sure that you introduce yourself nice and clearly. This will help you, number one, obviously establish who you are, and number two, build that rapport with the patient. Number three, check the patient's ID. Before you do anything with the patient, you need to make sure that you've got the correct patient in front of you. So if it's an actor or a patient, you would ask them for their name and their date of birth, and you would compare that to the vignette or the notes that you have in front of you. If it is a mannequin, you've got the wristband to refer to. Number four, explain the procedure. Again, before you get started on doing anything, you want to make sure that the patient has been consented. So this involves explaining the procedure to the patient. So a lot of these practical procedures have 1 to 2 lines that it's worth memorising. You want to explain the benefits of doing the procedure. So explain to the patient why it is that you need to do this practical procedure. For instance, we need to take a blood test today, and that is to make sure that it's safe for us to proceed with the operation we're doing today. You also want to explain the risks that are associated with a practical procedure. Again, depending on what practical procedure it is, they're going to have different risks associated with them. Number five, aseptic non-touch technique, extremely important. We want to encourage a sterile environment as much as possible when we're doing practical procedures, so make sure that you become familiar with all the different steps that are involved in order to keep the area as clean as possible. You want to show that you appreciate the importance of infection control. Number six, safe disposal of sharps, extremely important when you're doing any practical procedure that involves using needles or cannulation, etc. So make sure that any sharps that you use are disposed of then and there. There should be sharps bin available if you're doing a face-to-face practical procedure. Don't leave them lying around. Even if you run out of time, that should be paramount that you get rid of any sharps that you've used. And lastly, to end the consultation, you want to make sure that you thank the patient. So thank them for their patience, and also if you've asked them to undress any part of them for the practical procedure, ensure that you then tell them that they can now get dressed. You want to make sure that you document the practical procedure that you've done. For instance, you want to write in the notes what you've done, if there's any complications involved, that you use the aseptic non-touch technique, and also that you want to write down any further investigations or tests that you have done. If you're doing cannulation, you want to write in the notes that you've also done full blood count and used these, and that you've run them off to the lab urgently. Lastly, you want to make sure that you write down your name and your bleep number, so that if anyone needs to chase you in real life on the wards, that they're able to bleep you directly. I hope that you found all this information useful. It was just quick pointers to just get you thinking about practical procedures. The list is exhaustive, but these are really important, and you want to make sure that you get maximum marks in this OSCE stage. Best of luck with your exams.